A very good morning to you and welcome. Thanks for joining us for House Calls, Real Docs, Real Talk. I'm your host, Nancy J. And today we're discussing mental health and brain health. Now, you might think they're one and the same. I know I always have, but apparently they're not. So our goal is to uncover the differences today. We also hope that any of you dealing with feelings of loneliness or despair might find the tools to seek help after watching this show. But first, don't forget to hit the share button to let your friends and family know you are watching. We want them to watch this content too, because there's a wealth of great information ahead and everyone will be able to benefit from it. Also, throughout the show, we're going to ask you to get involved by answering a few viewer questions. To respond, all you have to do is text AHA Live to 22333. We won't ask for your name or any personal information. It's just a fun and easy way to answer. Now, if you don't want to text in, you can also participate by simply dropping your answer in the comments section. So let's get started. With me this morning is Dr. Deborah A. Levine, Associate Professor of Medicine, University of Michigan Medical School, Ann Arbor, Michigan. Welcome, Dr. Levine.
Good morning. Thank you for having me, Nancy.
So glad that you're with us. And before we begin, we're going to just kick it off with our first viewer response question. Which of these statements best describes your current attitude now that COVID restrictions are easing? A, I'm feeling hopeful. B, I'm feeling anxious. C, I'm feeling distrustful. D, I'm feeling scared. Or E, none of the above. Now we're going to get the viewers are going to be answering this, Dr. Levine, but what do you think about these choices?
Yeah, I think these are important feelings to recognize and for people to speak with their doctor if they're significantly affecting their life or not improving.
Okay, well, so now as we're taking a look at some of our responses, and looks like 60% of our viewers are feeling hopeful, but there's still, gosh, you know, a good group of people still feeling anxious and nervous. Is it okay to feel anxious and nervous, Dr. Levine?
It is okay to feel anxious and nervous. When we get concerned as physicians and healthcare providers when symptoms of feeling anxious and nervousness significantly impair people's ability to do their social, occupational, and other activities of life and enjoy themselves. So if you are feeling anxious or nervous and it's impacting your life in a serious or negative way, then please talk with your healthcare provider.
And of course, I see D there, none of the above. We do have some people who answered that. But I'll tell you what, sometimes I feel a little bit of each one, just because you never know how you're going to feel when you hear all the news and figure all this out. But I'll tell you what, this is good. I like the idea that everyone is at least feeling hopeful. So let's go to health in the headlines. Each week, we select one current headline that ties back to the topic at hand and ask our expert, in this case, Dr. Levine, to respond. This week's entry comes to us from Harvard Health Publishing, and the title is Sleep Well and Reduce Your Risk of Dementia and Death. Dr. Levine, is sleep the new frontier for brain health?
Yes, sleep is the new frontier for brain health. Studies suggest that inadequate sleep and sleep disorders increase your risk of cognitive decline and dementia. So it's important to ensure that you are getting adequate, restful sleep to optimize and ensure good brain health.
How much is enough sleep?
Yeah, so the studies differ in how they quantify or define enough sleep, but certainly getting at least 6 hours or more of healthful, restful sleep is important for good brain health.
Can you ever sleep too much?
That is a good question, and certainly there are rare disorders that are associated with abnormally excessive or inappropriate sleep, but those are rare, and so it's important to get more than 6 hours of good restful sleep for good brain health.
And just real quick, so is that uninterrupted?
To achieve good REM sleep, which is when we think that many restorative and rejuvenative activities of the brain are happening. And so getting more than 6 hours of continuous, good, uninterrupted sleep is important.
Okay, I will remember that. Let's get into our main segment now with live viewer questions in You Ask, We Answer. And as a reminder, while we're talking today, you can submit your questions in the comment section or submit them to heart.org/housecalls. Let's get to it. Okay, our first question comes to us from Regan in Georgetown. It's simple. What is brain health, Dr. Levine?
Yeah, so brain health is the ability of our brain to perform all the cognitive processes needed to carry out activities of daily living, including thinking, remembering, speaking, problem solving, and learning. And so a healthy brain is free of diseases like stroke and Alzheimer's disease.
Okay, well, let's go to Damien from Kansas City. He asks, is there a difference between brain health and mental health? This is a good question.
It's an excellent question. So brain health usually refers to your cognitive well-being, so how you remember, learn, and problem solve. Mental health usually refers to psychological and emotional well-being, so how you feel, act, and cope. Certainly brain health and mental health can affect each other. So if you think you are having problems with brain health or mental health, please contact your healthcare provider.
Okay, here is one from Marin in Ann Arbor. What are the risk factors for poor brain health?
There are many risk factors for poor brain health, and we distinguish them by what risk factors are modifiable versus what are non-modifiable. So starting with non-modifiable risk factors, these include older age and family history of dementia. Obviously, those are things we can't change, but the good news is there are several modifiable risk factors for poor brain health. And these include vascular risk factors such as high blood pressure, diabetes, high cholesterol, behaviors like smoking, excessive alcohol use, physical inactivity, obesity, and poor diet, clinical factors such as depression, sleep disorders, and hearing loss. And then another important risk factor is social isolation.
Social isolation. And you know, as you were talking, and we've done some shows in the past about high blood pressure, does high blood pressure affect brain health and mental health?
High blood pressure does affect brain health. It is an important risk factor for cognitive decline and dementia. And we have exciting research that lowering high blood pressure and controlling high blood pressure can reduce one's risk of cognitive impairment and dementia. And I'm sorry.
Oh, no, go ahead. Go keep going.
Yeah, and controlling high blood pressure is a major tactic for preventing stroke. And preventing stroke is important for brain health because a stroke can increase the risk of dementia by up to 50 times.
Okay, so I was wondering then, does getting enough sleep help prevent high blood pressure or bring your blood pressure down?
Yeah, so that's a very good question. There have been studies that suggest that treating sleep disorders, particularly sleep apnea, certainly can reduce blood pressure. And we also know that healthful sleep might also ensure that people have blood pressure that's optimal, but more research is needed.
Okay, good. Well, let's go to Chris. And Chris asks, are there symptoms of cognitive decline to look out for, and can it be treated?
Yes, so there are symptoms of cognitive decline to look out for, and these include declines in your ability to think, learn, remember, speak, and problem solve from a previous baseline. And so the important feature is that there's been a decline in your ability over time. And if you or a loved one are concerned about a decline in your memory or your thinking, then please contact your healthcare provider for evaluation and cognitive testing.
So we can't really prevent it, but we can catch it, or is
Yeah, so we actually, so the promise is that we can prevent dementia and cognitive decline by preventing stroke, controlling your vascular risk factors, engaging in healthy behaviors, and treating problems like hearing loss, depression, and sleep disorders that can increase your risk of dementia and cognitive decline. But we actually lack effective treatments such as medications once cognitive impairment and dementia have started. And so that's why it's so important to prevent. We can also, though, always treat the person with cognitive problems by helping to optimize their sleep, their hearing, their vision, reducing or removing medicines that might be clouding cognition, and ensuring that their vascular risk factors are controlled and they're engaging in healthy behaviors, exercise, mental activities, and socially engaged.
Great discussion so far, Dr. Levine, but let's take a break for another viewer response question. So grab your phone and get ready to text in your answer. And do remember, all you have to do is text to AHA Live 22333. That's what you text it to. And if you're already registered, you don't have to do it again. Or if you're joining us from your phone and it's easier, just drop your answers into the comments. Our question is true or false? Dementia is an old person's disease. Okay, while we wait on you to reply, don't forget to check out our newest show, At the Heart of It, with Nancy Brown. If you haven't seen it, it can be accessed through the American Heart Association's YouTube channel, which is what you're watching right now. Season 2 is in the works, and we're so excited. So while we think about whether dementia is an old person's disease or not, let's take a quick look back at Season 1 of Nancy's show.
Be the author of the only dictionary that defines you.
Insightful conversations with celebrities, influencers, and thought leaders.
Welcome to At the Heart of It.
CEO Nancy Brown holds intimate discussions on overcoming obstacles and sharing wisdom on wellness.
Resilience means that you have inner strength.
Get inspired.
I'm ready.
With At the Heart of It.
I like that. Okay, so let's see. Dementia is an old person's disease. Look at that result. Dr. Levine, it looks like the majority of people think it's false.
Yeah, so it is a tricky question. So certainly older age is a risk factor for developing dementia, but not everyone who lives to an older age develops dementia. And we certainly want to decrease the number of people who do develop dementia in older age. And we certainly know that there are younger people who develop dementia also due to family history or other risk factors such as head trauma and things.
And so Alzheimer's is a product of dementia. Is that correct? Is dementia sort of the what covers it all?
Yeah, so dementia is an umbrella term for objective cognitive impairment that impairs your ability to do the normal activities or basic activities of living, such as bathing, cleaning, feeding oneself. So when your cognitive decline has advanced to the point where you're having trouble taking care of yourself, that is dementia. When you have cognitive impairment that does not severely impair your ability to do your activities of daily living, that is now considered mild cognitive impairment.
Okay.
And Alzheimer's disease is one type of dementia.
Okay. Well, I'll tell you what, to those who responded, thank you. And I think everybody gets a passing grade because you said this was a tricky question.
Yes.
Okay. So let's get back to more viewer questions. Maybe they won't be so tricky. Here's one from Rosemary in El Paso. Is it true that crosswords and brain games can help fight cognitive decline?
Yes, so mental activities might help decrease your risk of cognitive decline and dementia. Even in patients with cognitive impairment, there is a benefit. So we recommend that people exercise, do mental activities such as reading, learning, puzzles, crosswords, and also participate in social engagement.
Okay, well, that's social engagement, something we all need for sure. So, Mia from Huntsville, Alabama is wondering, this is just perfect timing. Is it true that loneliness and social isolation can hurt brain health?
Yes, so unfortunately, social isolation is a risk factor for poor brain health. So we recommend that people engage in social activities, being with family, friends, community members, to prevent cognitive impairment from developing or worsening.
Okay, so I guess even making Zoom calls or FaceTiming with your friends, that's helpful too, right?
Yes, any activities, whether virtual or by telephone or in person, is considered social engagement and can be beneficial for good brain health.
Okay, good. Well, let's take just a couple of more questions, and then we may be out of time for today. Minnie in Fresno is asking, are there concerns around the impact of the COVID-19 pandemic on brain health and or mental health?
Yes, there are serious concerns about the impact of the COVID-19 pandemic on brain health and or mental health, both in terms of the direct impact of the virus on the brain and those who've been infected by the virus, but also due to the social isolation and lack of social engagement from all of the social distancing and quarantining that people have had to do as a result of the pandemic.
It seems like we've mainly been talking about adults, but what about children? They too can suffer with brain health, right? If they're not getting the correct impact from other people and meeting people and being with their friends?
Yes, so it's less studied, but we certainly know that risk factors for cognitive decline can begin in childhood, for example, high blood pressure. So it's important to start these healthy behaviors early in life and continue them lifelong.
Okay, good. Well, our final question for today is from Roman, and he asks, what can be done to maintain brain health?
Yeah, so there are lots of things you can do to maintain good brain health. Number one is prevent stroke. So work with your doctor to identify and control any vascular risk factors like high blood pressure, diabetes, and high cholesterol that you have. Engage in healthy behaviors by avoiding smoking, excessive alcohol intake, maintaining a healthy weight, exercising regularly, and eating a healthy diet. And then looking at your sleep and mood and seeing if there are ways that those can be improved if they need to be so, and then engaging in social and mental activities.
Those are all good suggestions. And what's been great is I know with the American Heart Association House Calls, we have been doing a lot of these topics. And it just seems like sleep is a good way to say thank you for spending your morning with us, Dr. Levine. Hopefully nobody has fallen asleep. They'll have to wait, right?
Correct.
You've given us so much to think about. Is there anything else that you'd like to add before leaving us and getting back to work?
I would just very much appreciate the time for being here and encourage people to try to be as healthy as possible and to talk with their doctor if they are feeling issues with their brain and mental health.
Okay, well, thank you so much again, Dr. Levine, and say hello to everybody in Michigan. That does it for our show. Don't forget, you can find any of our previous shows at heart.org/housecalls. And like Dr. Levine suggests, do keep your brain engaged. It needs exercise just like your other muscles, right? And if you're feeling lonely and isolated after this past year, remember, you are not alone. We all yearn for connection. The good news is there is a remedy. Go get your vaccine. It's as simple as that. We'll see you next week when we talk about vaccines and vacations. Come on, let's get packed up.
Getting back to this. To her. To family. To friends. To hugs. For people at higher risk of COVID-19 complications because of diabetes, high blood pressure, and heart conditions, the COVID-19 vaccine is an important choice. Consider it's the first step towards getting back to what you miss so much safely. Getting back to life. Set your heart on it. It's up to you. A message from the American Heart Association.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.